था.
It's okay. Hello. Hello.
Yes, ma'am. We can see your slide. Just press the next button.
You can hear me also.
Yes, ma'am. Yes, ma'am.
Great. Done.
Okay. So I am making Dr. Swapnil presenter.
All right. Done.
So good evening all. We will start in 2 to 3 minutes. Let's other people join. Till that I am muting my mic. Dr. Swapnil, you can share your screen now.
Just a moment. Can you see my screen? Chinmay?
No. I can't see your screen.
How can you see my screen?
No. Let me make you again. Yes, now I can see. Yes. Can you go to full slow slide show? Dr. Swapnil, please do slideshow. Yeah, done.
Start?
Yeah, it's okay. Done.
Okay. Shall I start?
Yeah. No. We'll wait for 1 or 2 minutes, then we will start. Good evening all. We are waiting for only 2 minutes now for others to join. So this is our last presentation by the resource persons, and next week onwards we will have a presentation by different groups. And once the presentation is finished, today's presentation is finished, I will share the timetable.
Shall I start? Begin?
No, I will invite you. Are you able to hear me? Dr. Swapnil, are you able to hear me? I think he is not able to hear me. So once the presentation is over today, I will share with you the timetable and how we will go ahead. Yes, we will start. Over to Dr. Swapnil Parlikar, sir. Today we have a three presenter,
Yes,
Dr.
yes.
Swapnil
Now I'm
Parlikar.
able to hear you clearly.
Okay. So today we
No,
have
I'm
a
able to hear
three
you
presenter.
clearly.
Okay. Okay. So we have a three
I'm able to
resource
hear
person
you.
today. Okay, Dr. Swapnil. We have a three resource person today, Dr. Swapnil
Hello.
Parlikar, Dr. Richa Simon, and Dr. Munal Pathak. So sequentially, first Dr. Swapnil will be there, then Dr. Munal will be there, and then Dr. Richa will be there. And they all will enlighten us regarding assessment in CBME. So now over to Dr. Swapnil Parlikar. Dr. Swapnil, you can start now. Dr. Swapnil, you can start now. Dr. Munal, are you able to hear me?
Yes, I can hear you, Chinmay.
Okay, thank you, ma'am. Thank you, ma'am. Dr. Swapnil, you can start now. Let me call him.
Hello. આ મ્યુટ નું આ મ્યુટ નું એ થઈ
Yes, Dr. Swapnil, you can start your presentation. You are audible now.
Can you hear me, Dr. Chinmay?
Yes. Please start your presentation.
Now I'm connecting with my computer audio only. Yes. Shall I begin?
Yes. Please.
Good evening. Shall I begin, Dr. Chinmay?
Yes.
Yes. Good evening to all the respected colleagues and physiology. Today's topic is assessment in competency-based medical education. I'm Dr. Swapnil Parlekar from Government Medical College, Bhavnagar, and my co-presentators for the day are Dr. Nudal Fatak Madam and Dr. Richa Madam. We know that students learn what is assess. Assessment drives learning. Assessment is the tail that wags the curriculum dog. Hence, it is so pivotal in the entire tapestry of medical education. Experts say that in all geographies where competitive medical education has failed, that is due to a lack of robust assessment. Hence, competency-based medical education itself boils down to good assessment. Good assessment meaning that it should be valid, reliable, feasible, objective, and should have an educational impact. You must have seen this picture many times. This is about and an elephant. And this is based on a poem by Jack Sachs written for children. And when one blind man catches hold of the tusk, he says that it is a spear. When he catches hold of the tail, he says that it's a rope, and so on. So this might remind you about traditional assessment. So now I'm having one activity, that is chat box. What do you think about traditional assessment? What are the characteristics of traditional assessment, either in 2 to 4 words or at least then in one sentence? Please write in the chat box.
If you can use the chat box, and also you can write in the WhatsApp group also. So one response is it is not uniform. Limited, more based on recall.
Yes.
Less objective. Traditional
Less
assessment is
objective.
subjective. It is based on what the examiner think is important.
Yes.
Students are passive. Assess mostly memory. Can be biased. Each one has their own ways. Synchronous.
Okay.
Okay. At teacher pace and not at student pace. Mostly summative. Teacher based. Assessment of learning, not learning. Fixed hours, repetitive, objective. Stereotype. Not competency based. Teacher at active, student are at passive role. Difficult to assess in short duration. Subjective. So these are the different options or reply we have received, Dr. Sapil.
Okay. So you have pointed out most of the characteristics of traditional assessment, and these are also the some of the lacunae which are there with the traditional assessment, it being subjective based on the examiner, and more based on the whims and on the examiners than it being periodical rather than on a continuous daily basis. So traditional assessment, I'll point out some characteristics which are given in the MCI module. So like this picture, traditional assessment is a snapshot assessment. It has tended to be a snapshot assessment. That is, the student is assessed at periodic intervals, and hence they are called as periodicals. So instead of grading the student, giving marks to the student on his day-to-day performance, this is a periodical assessment, and a one item may help the student to get good marks for the entire semester. While if unfortunately the student does not do well on that day, or he is unwell, then Even if he has done well throughout the semester, then he'll most likely not succeed. Then again, you may find that at times it is not aligned to the instruction. That is, you might have taught some topic which might be of utmost importance from a core area, clinically relevant, and then some examiner pull out a question just like this magician pulls a rabbit out of a hat. And finally, it has tended to be not accompanied by feedback. And whenever feedback has been provided, it has tended to be negative. So we have a term which is in vogue, that is teaching by humiliation. So teachers tend to give a lot of negative feedback. They tell the student that you don't know this and you're lacking in this, and then feedback is not given at all. So these are some of the characteristics, and I would say the lacunae of traditional assessment. Now we move to competency-based assessment. The learning objectives for the entire session are that define the terms summative and formative assessment and internal assessment. Compare the traditional method of assessment with competency-based assessment and list at least 5 methods of assessment in a competency-driven curriculum. Design assessment tools as suggested by the MCI module and list the changes in GMER 2019 with regards to assessment. So I'll be taking the first learning objective, that is the definitions. And the erstwhile MCI in its module on assessment says that all competencies should be assessed. So what should be assessed? Preferably all competencies should be assessed either in the formative or in the setting. With regards to assessment, there is one paradigm that like this banana, which can be seen, which can be measured, whatever is measurable and hence observable can then be assessed. For example, we were in a dilemma with regards to assessment of empathy. But once the Jefferson scale of clinical empathy came about, we could measure it, and now we can assess empathy. And for the sake of convenience, we should form a an outline, a blueprint, so that we can assess all the competencies either in the formative or in the summative. I'm just coming to the definitions. So summative assessment. What is summative assessment? Assessment at the end of instruction to pass and fail. So in this assessment, it is at the end of instruction, the final exams where pass and fail decisions are made rather than giving some feedback to the student for his improvement. And what is formative assessment? Assessment during instruction to provide feedback to improve learning. So for our purpose, any internal assessment, when it is accompanied by feedback, it assumes a formative nature. And rather than assessment of learning, it is assessment for learning. So it provides continuous information to the student as well as to the teacher, so the teacher can also modify his teaching learning accordingly. You must have seen this movie Chinikam. So in the first scene, the customer has tasted the dish and the chef is already given a fail verdict. While in another scene, the chef tastes the dish which his cook has made and then gives him feedback. So as Paul Black, who has done assessment in the classroom setting, said that when the cook tastes the soup, it is formative assessment. And when the customer tastes it, it is summative assessment. So assessment accompanied by feedback is formative assessment, and it is assessment conducted by the teachers teaching a particular subject to know what is learned and how well it is learned. So these are the characteristics of traditional assessment, and some of the definitions, summative, formative, and internal assessment. So thank you. And now I request Dr. Chinmay to hand over to Dr. Munral Phatak Madam for the next part of the presentation. Thank you.
Dr. Swapnil. Yes, ma'am. Now you are
Yes.
presented. You can share your slide. Yes, please.
Okay. Can you see my
Yes, ma'am.
screen? Yeah.
Yes, ma'am. Yes,
Okay.
ma'am. And you are audible also, ma'am.
Yes.
Okay. A very good evening to all the physiology fraternity. It gives me immense pleasure to communicate with you on this platform where we have taken such a huge task, and all of us are doing so very well. So congratulations to all of us. Of course, Chinmay is taking the lion's share of that. So I begin my presentation of principles of assessment for CBME. Now, what is the purpose of assessment? Why do we need assessment at all? What do you think? You can put in the chat box. What are your what is the reason why we need a assessment for anything? Leave alone the course that we are studying or the program that we are undergoing. Why do we need assessment? You can just put in some few feedbacks, some in the chat box. You can put in why we need assessment.
To know what is understood, to check the quality,
Yes.
to know the knowledge gained by the student during the course, to know the outcome, to facilitate learning, to monitor learning, drive to learn, to know how much
Yes.
is achieved and how much is left, scope for improvement, improvement of teaching learning.
Okay. So you are encompassing the whole aspect in one single shot. So it's very nice. Basically, assessment is required to prove something and to improve something. Now, what do we need to prove? We need to prove that the student is eligible to progress to the next year or to the next level of the course, to declare him pass or fail, to progress further on in the course, or for some selection into the course. So this is proving that he has the knowledge, he has been assessed to his competency as per CBME, and he is now eligible either to pass or to progress or to get selected into the course. Now, to improve is, it should be an ongoing assessment to improve the quality of learning. So it is a lifelong learning process wherein the learner keeps on learning. So it is not restricted to some particular course or program or some duration or to achievement of some degree or post or something like that. So it is a lifelong learning process, an ongoing process wherein the learner keeps on improving his quality of learning. So these are the two reasons why the assessment has to be undertaken. Now, the objectives of my session here is that I would like to, at the end of the session, the faculty should align the assessment with the competencies and should know the criteria for internal assessment and professional exams vis-a-vis the CBME. Now, how much do we know about assessment? I'm sure we all know about the Miller's pyramid for competency assessment. We know the different methods of assessment pertaining to all the domains of learning. And of course, we know how to set a question paper. So the base knowledge is that depending on the Miller's pyramid, these are the different assessment modes that we use to test the different aspects of knows how, shows how, and does. So as the pyramid goes on increasing, the quality of assessment changes. For knows, only for cognitive domain, Theoretical questions like MCQs, essay type, or Viva, which is a verbal communication, that is also sufficient. For knows how, we use MCQs, MEQs, which are problem based. For shows how, it is a practical based knowledge, so we use it in the practicals or COSPs. The main crux is the does, that is application of the knowledge in the scenario or in the life. So those are assessed. How do we assess that? So those clinical examinations or 360-degree assessments, so these are the different modes of assessment to see the application of all the knowledge which he has learned. Now this is an assessment toolbox where we use the workplace based assessment, which is used to assess all these different qualities. That is whether the documentation of work is done, direct observation we do, whether the person or the learner has actually learned the skills which have been taught to him. So for documentation of work, what is used in CBME is the logbook and the clinical encounter cards. For direct observation, it is the mini clinical evaluation exercise, then direct observation of the skills, acute care assessment tool, and the clinical work sampling. Then for individual cases, it is again case-based learning or case-based assessment. Feedback on performance, if we want to assess this, then it is done through mini peer assessment tool and patient satisfaction questionnaire, wherein the patient gives a feedback. So this here the feedback comes into play. Then assessment of knowledge and skills, again by theory and practical, so by MCQs and by OSCEs or OSPs. And record keeping, this is assessed by the portfolio which the student has to maintain throughout the course. Now, assessing higher learning, the simple formula is you have to move up the pyramid. So from the base to the top, you have to assess every aspect of the learning which has occurred during the program. So you have to frame questions which can't be answered from memory alone and require application of knowledge. So that is where you have reached the tip of the pyramid. So you use higher level action verbs. Some of the action verbs are these. So you can just go through them. So if you want to just know the knowledge, that is the knows aspect, the verbs used are simple: define, describe, draw, and so on and so forth. But if you have to reach the tip of the pyramid, that is the synthesis and evaluation, then you have to frame the questions starting with the verbs compose, construct, create, or appraise, assess, conclude, and so on and so forth. So you see that what you are assessing at the base of the pyramid, the knowledge, you can assess with the questions beginning with define so and so, describe some aspect. But if you want to assess the application of the knowledge, you have to use the different complex verbs while starting the question. Now the key features is direct observation. So direct observation tells you particularly for practicals or skill-based competencies. Of course, the competencies are so well defined here that the competency becomes the end point which we have to reach, and it helps the learner to acquire competence. Now, how do we align the assessment? We have got objectives. All of us have framed the SLOs according to what has been assigned to us. We have also seen the teaching learning methods based on these SLOs. Now, the assessment which we are planning for that particular objective should be relevant to the objective and the teaching learning method. So this should be aligned in such a manner to ensure that there is specified learning. So alignment means that your objectives, activities, and assessments match so that the students learn what you intend to teach and you accurately assess what the students are learning. So this is how the aligned curriculum will look like, where the objectives decide the teaching learning methodology, the teaching learning methodology decides the assessment, And the assessment drives the teaching learning methodology as well as the objectives. So the continuous feedback received from the assessment decides on whether the teaching learning methods are to be changed or the objectives are to be changed. Now, one important aspect of blueprinting, this will be taken in the next session also quite in detail. I'll just like to touch upon it here, that blueprinting tells us what methods we require, what are the assessment methods that we require. This is mainly depending on the relevance to practice and the feasibility in a particular institution. See, everything that is relevant to practice need not be feasible at every institute. There are places, there are institutes in very remote places where simple BP apparatus also becomes a luxury. So relevance and feasibility both have to be taken into account while assessing the performance of a learner. Now, if the relevance is low and the feasibility is high, then the certification of independent performance is not essential. So you consider the opportunities to observe, assist. So those are enough. So traditional methods suffices for this. But if relevance is low, feasibility is low, hardly anything. You hardly have to pay any attention. Relevance is high and feasibility is high, then the learning pathway should lead to certification of independent performance. So you have got something which is highly relevant to practice and feasible, available in all the institutes. Then what you do, you plan the OSCEs and OSPs in such a way that individual performance of the learner can be assessed, and the skills which are to be learned, they can be learned by the individual. The certified skills, they come under this heading. Now the fourth one, that is the relevance is high but the feasibility is low. Now the problem area is this one, the fourth one, where it is very highly relevant to practice, but most of the institutes do not have the feasibility to teach these particular activities. So in this region, we have to build the capacity by considering collaborations with other institutions, or you use the skill labs or the simulations. So an example of low feasibility, high criticality, demonstrate basic life support in a simulated environment. So domain of skill is what? It shows how. You have to demonstrate. So you have to show how you're going to do the BLS. Suggested method is DOAP session, and the assessment will be OSCE. So you know that what is your objective, what is the domain in the Miller's pyramid, how are you going to teach it, what is the teaching learning method that you have used, and how are you going to assess. So these are all aligned in such a manner that that particular learner, though the feasibility is low, though the patients are not available to provide the basic life support, still with the help of a skill lab or a simulated environment, the learner is able to demonstrate how he is going to do the BLS. So in a real life situation, the feasibility of independent performance by this learner may be low, but since the criticality is high, it is a must, and skill lab training helps in this region. Now, opportunities for assessment that we have are informal and formal. Informal are the continuous assessments or the class tests or the end of system tests that we all take. Formal assessments are the ones whose marks really count for the progression of the student. That is the internal assessment and the university examination. Now, informal opportunities of assessment, they are very important because they provide the much needed feedback to the learner, helping them to improve. So this is a very informal and non-risky environment where the student is not under any kind of stress. The marks are not considered for the promotion of the individual. So it doesn't matter even if the individual fails or even if the learner fails. So because there is no stress about the marks and it is not taking a role in decision making to the progression of the learner, this allows the student to open up and perform without any tension. And this is what we want. And if the learner is not able to perform in a non-stressful environment, then we can give a feedback to the learner that you are not up to the mark, you need to gear up. You need to change your strategy of learning so that you are able to perform well, whether it is a stressful situation or not. Formal opportunities, internal assessment and university examinations. Now each one of it decides or assesses a different aspect of teaching learning. The internal assessment tells us how he or she has learned, and university examinations assesses how much he or she has learned. So both these assessments are important. Therefore, we are giving weightage to internal assessment also and to university examinations also. Based on both these assessments, only the learner will get promoted to the next session or next year. So internal assessment, I would just like to briefly fast go through this. You all know this extract from GMER 2019, that we have got regular periodic examinations throughout the course. There shall be no less than 3 internal assessment examinations in the preclinical and paraclinical subjects, and no less than 2 examinations in each clinical subjects in a professional year. So in a clinical setting, because it is taught across the years and across the sessions, therefore end of clinical posting assessment has to be conducted in each professional year for the clinical. For us, for physiology per se, we have to have no less than 3 internal assessment examinations. In subjects that are taught more than one phase, like in medicine I said, so we have to give more than 3 internal assessments. They have to be assessed in second professional, third professional part 1 and third professional part 2 independently. Now, day-to-day records and logbooks should be given importance in the internal assessment. So we have got very well-framed logbooks, and students are made to enter their reflections of different activities which we are undertaking, SDLs, ECs, AITs, and so on and so forth. So they are reflecting on that, and we are going to assess their logbooks also. Now, internal assessment should be based on competencies and the skills. Eligibility made mandatory before a student is allowed to appear for the final university examination. So he has to be eligible in the internal assessment examinations before he is allowed to appear for the university examination. At least 50% marks are needed in theory and practicals together to appear for professional examination. Of course, one more thing MCI has put up now, that 40% should be there in theory and practical. So it should not be total 50% is okay, but it should not be 20% and 80% or something like that. So at least 40% are required in theory and 40% in practicals, and a total of 50% marks are required in the internal assessment examinations. Results of internal assessment must be displayed on notice board within 2 weeks of the test. So you have some betterment or remedial also. Certifiable competencies and logbooks should be complete to appear for professional examination. Remedial measures must be taken to achieve the desired 50% prior to declaration of results for betterment or for missing of the test. So this provision has also been made in the GMER. Passing in internal assessments will be separately shown in the final result. So these marks are not added to the professional examination marks, but they are shown as a separate head of passing in the mark list, which is given to the student at the end of the final examination. Now, theory examinations, it is advised that you use multiple tools like LAQs, SAQs, and MCQs. So multiple tools are always better in practicals also, in theory also. MCQs should not be more than 20%. In subjects that have 2 papers, the learner must secure at least 40% marks in each of the papers and minimum 50% marks in aggregate. Then only he is declared successful and pass. For the practical examinations, we have to assess the proficiency in skills, the data interpretation, and logical conclusions. So clinical cases should match what a practitioner is likely to see in actual practice. So whatever clinical cases we are giving, we cannot give some abstract and rare cases just because we have created an ideal case from the books. So what the learner is actually going to see in real life situations, we must try to match those cases, or the like we have got paper based cases, we have got videos, we have got all different modes in which we are taking ECs. So it has been taken wonderfully by earlier presenters. Now when we assess the clinical aspect of learning, the clinical cases which we keep for the examinations in the OSCEs, we should try to match them to what are actually seen in real life or real practice. So you avoid the rare cases and syndromes, focus on data gathering, physical examinations, writing records, and the management plans. Maybe his diagnosis may be faulty, or he may not reach up to the mark, but you see the process, you see whether he has attained that level by data gathering, physical examinations, all the steps of the clinical examinations, whether he has attained the skill or not. Now in the Viva, you assess the approach to patient management, to different emergencies, his attitude. This is one area where you can see the attitudinal skills, the ethical and professionalism. So all these values can be assessed. Skill in interpretation of common investigative data like X-rays, ECGs, etc. These also can be assessed in the Viva. Now, Viva marks are to be added to practical. So this is something different from the traditional assessment that we have been undergoing so long. The Viva marks initially used to be added to the theory, but in CBME, the Viva marks are added to the practicals. Now, Atcom competencies also need assessment, and of course attendance is required for eligibility to appear, 75% attendance. Internal assessment should include written tests comprising of short notes and creative writing experiences, and OSCE based clinical scenarios and Viva voces. So all of this should include the Atcom competencies. So at least one question in each paper of the clinical specialties in the university examination should test knowledge competencies acquired through the professional development program, that is the Atcom competencies. So also skill competencies acquired during this PDP must be tested during the clinical, practical, and Viva voces. So all the levels of assessment should include at least one question of Atcom competencies. Now this is the examination schedule. All of you know this very well, that we have got a 1-month foundation course followed by 11 months of first MBBS. Exam of first MBBS is in September. Then second year MBBS is again 12 months, where the exam is in September again. So earlier it was 1.5 years, the second MBBS. Now it has become 1 year. Third MBBS is split into two, part 1 and part 2. The exam of part 1 is in October, and part 2 is in January. Then it is followed by internship. There is a 2-month slot of electives and skills in MBBS part 2, third MBBS part 2. So that's why the duration of the third MBBS part 2 is increased. Now this is how the plan of the examination is as per CBME. So you can see for physiology there are 2 papers. 200 marks are allotted to theory. So you've got 100 marks per paper. Practicals with the Viva voce is 100 marks. The pass criteria in the internal assessment is 50% combined in theory and practical, but not less than 40% in each. For university examinations, again it is 50% marks in theory and practical separately. Internal assessment marks are not to be added to the marks of the university examinations, but to be shown as separate head. So you have got assessments, formative assessments, which are continuous, in-class assessments, They are very much based on the feedback. We give a very robust feedback, should be given to the students based on these assessments, and logbook forms an important aspect of this assessment. Then is the internal assessment, where 50% eligibility is required to appear for the summative examination, 50% mandatory to be declared as successful in summative examination. Here also weightage to logbooks is given, and internal assessment marks are to be reflected as a separate head of passing in the summative examination. And last is the summative examination, where you have 2 theory papers having MCQs not more than 20%. In subjects that have 2 papers like ours, we should have 40% marks in each of the papers, and the aggregate should be at least 50% to be declared as pass. Viva marks to be included in practical, and Atcom questions to be included in theory as well as practical assessments. So implications, which, or the take home message which I would like to say, that the assessment in CBME should be multifaceted. So you have to use various assessment methods which I have discussed. Assessment has to be continuous, frequent, authentic, robust, and work-based. And it should include narratives. So reflections from the students is also important. Direct observation is essential, and regular feedback is essential. So thank you. With this, I complete
Ma'am?
my session. Yes, you can hand it
Yeah.
over to Richa now. Richa can continue.
Yeah. Over to you, ma'am.
Yeah, thank you so much, Chinmay. Yeah. Good evening, everyone, and Sat Sri Akal from Amritsar. I'm so happy to be with my peer group, my physiology peer group. I am Dr. Richa Thaman, and I am from SGRD University of Health Sciences, Amritsar. So I'll be taking up the assessment forward, and we'll be talking a little about the practical aspects of that. Dr. Pathak has taken up the basics of assessment, and I'll be dealing a little bit on the formative aspect of assessment. Now here in our university, I just wanted to show we have developed this app for formative assessment. So how the history goes is that I went for an as an observer to a medical institute for the revised basic course, and one of the faculty came to me that, ma'am, in the discussion of the formative assessment, I want to show this. I've used this app. There was a quizzes app, and students have given a very good feedback to it, but there are so many problems with that. So it just struck me, why not make our own app for the institute? So this is how it is. Now this app has been constructed in the institute, and all students have this app on their mobile phones. Right. Now, how this is an MCQ app for formative assessment. Now the key points here are that for the students, this is an interactive way to learn. It helps in the revision of the topic. It helps in identifying the weak points. So many times what happens as the class finishes, you can add 5 questions just to that app and let the students answer them. And this will give a feedback to the teacher as well, what the students have learned or what are the aspects that students have yet not learned. For teachers, it is a quick feedback, what students have learned. It's a quick evaluation and performance report, and you can view student performance graphically as well, as I will show it subsequently. Now let's begin how to use this app. Now every person has been given a username and password. You type your username and password and log into the app. This is the teacher panel. This opens up after that, and you can create the quiz. You can create the quiz from this end or this end. So there are quiz details of what all the quizzes that you have made till now. Then there are class quiz, live quiz, submissions, everything is there. How to create a new quiz here? You can create a new quiz. You can give the title to the quiz. You can make sure whether it is visible only to you or visible to other faculty members. Whether you want to use a timer or you just want to give this this app, this questionnaire to the students, and they can answer at their own time at home. So you can give overall timer or no timer or timer per question timer. Marking schedule may be same marks for each questions, or you can vary the marks accordingly. And there are three types of quizzes you can form: the normal quiz, class quiz, and the live quiz. All right, so you have a question. You can type your question here. Give 4 options here: option 1, option 2, option 3, and option 4. If you have time, you can also give the explanation. But if you're taking the quiz in the class, of course, you can discuss it in the class as such. Or if you have more time, you can also answer. You can give the options, explanations for this. Then quiz type. There's a normal quiz, which is good for practice and can be assigned to specific students. Even you can assign them to specific students or to class. Usually we use the class quiz, where it is good for quiz during the class. Teacher will generate code for specific time. We can generate a code and students have to, enter that code. Once quiz is started, each student will get random questions automatically. Live quiz is good for real-time quiz during the class. Teacher generates the code and students need to enter that code. Quiz is fully controlled by the teacher, so teacher can add questions one by one at that time as such. Then search the quiz. You can search for whatever quizzes you have made. You can type it and you can search it up. At the end of it, once you've made the quiz, you can generate a code, and this is the code. You can keep the code open for 2 minutes or 5 minutes accordingly, and the students can log in and they can answer. Now, this is what you get once the students have answered and you close the quiz. This is the table format where for each question, you know what are the options, how many students have answered that correct options, and so on. Then results in graphical formation. This is the results in graphical formations. And this is the leaderboard. Each student's how many correct answer, how many incorrect answer, and what are the total marks. So what is your work is the initial work in designing this. That's it. And somehow we started this quiz at the end of January because we found it very relevant, specifically for formative assessment, because after the STL class or after the ECA class, what happened was we used to ask few students for certain questions and they used to answer. But once we started using this quiz, all 150 students of the class used to answer it, and we used to get a feedback that how the STL or the other session went back. So this was a good way of formative assessment for the students. And somehow this app became so relevant to us perchance during the COVID times, because students were at home. So how to assess the students? So we use this app to assess students from wherever corner they were sitting. So this became relevant. So I thought that maybe this practical aspect I would like to share with you. Then I continue forward with regulation of GMER regulations, which Dr. Pathak has slightly touched upon. And I'll be taking it forward, and then we'll talk about a little bit about the blueprinting which we have developed. So the first professional, So the first professional year commences with the induction through I'll just quickly go through this. The first professional year commences with the induction through the foundation course by 1st August. Supplementary examination shall not be conducted later than 90 days from the date of declaration of the result of the main examination. A learner shall not be entitled to graduate later than 10 years from joining the first MBBS. And no more than 4 attempts shall be allowed to pass first professional, and not more than 4 years to pass first professional exam. Partial attendance for examination in any subject is counted as an attempt. A learner who fails in the second professional examination shall not be allowed to appear in the third professional part 1 examination unless he passes all subjects of second professional examination. Passing in third prof exam is not compulsory before starting the part 2 training, but you have to pass the third professional examination to be sitting for the third professional part 2 examination. Second, professional clinical postings shall commence before or after declaration of result of the first prof, and this depends upon the institute and university. The third, professional part 1 and part 2 clinical postings shall start no later than 2 weeks after completion of the previous professional exam. Eligibility to appear for professional exam. This all of you know, we need 75% in theory attendance and 80% in practical. In subjects which are taught for more than one phase, we need 75% in theory and again 80% in practical in each phase. Suppose it's a community medicine or a medicine subject which has been taught through different professional years, so we need 75% in theory and 80% in practical on professional years separately. If an all right, we've already discussed this. Learners who do not have at least 75% in electives will not be eligible for third prof part 2 examinations. This we've discussed. Foundation course, compulsory 75% attendance, 75% attendance in Atcom module and 75% in electives, and submission of logbook maintained during elective is required. Learners must have completed the required certifiable competencies for that phase of training and completed the logbook as appropriate. The next and the last aspect that I'll take forward is the blueprinting, because I think everybody will be busy with designing the blueprinting as far as the exams are concerned, because it is just first chance that the first prof couldn't have their exams. So this is the blueprinting that we formed. Total marks in the theory at 200, paper A 100 marks and paper B 100 marks. Topics in paper A, general physiology 10, nerve muscle physiology 10, nervous system and special senses 40, endocrine 25 and reproductive 15, and we have total 100 marks. For paper B, CVS 24, hematology 24, expiratory system 15, gastrointestinal 16, respiratory 16, integrated physiology 5, and we get 100 marks. Now the theory paper should include questions from core competencies and not from non-core competencies. This is the blueprint grid. Here we have the long answer question. The question should pose a clinical practical problem to the student and require them to apply knowledge and integrate it with the disciplines. We should avoid giving one-liners as questions. The question stem should be structured and marking distributed should be provided. So each part of the structure should be provided marks. We should use action verbs from higher domains. Now here paper A should have 2 questions, long essay type questions, and paper B also 2 questions, structured questions from core competencies. Here case-based questions we have formed. Every university can have their own, from thyroid disorders, menstrual sign, this and this. Distribution of marks is 1 into 10, so 10 marks plus 10 marks with 20 marks long answer essay questions. Short notes, these provide opportunities to sample a wider content, albeit in a short period of time. Questions should be task oriented rather than write short notes on so and so. Preferably use verbs in framing questions and structure them as far as possible. Paper A, 8 questions. Paper B, 8 questions. Each question of 5 marks. So total marks are 40. Then comes the reasoning questions. These provide excellent opportunities for testing integration, clinical reasoning and analytical ability of the students. Paper A should have 3 questions. Paper B again 3 questions of reasoning, and each question 5 marks, 15 marks. Then applied questions. Paper A 3 questions. Paper B also 3 questions from core competencies, and each has 5 marks, so 15 marks for applied questions. MCQs, 10 MCQs in paper A, each MCQ of 1 mark, and similarly 10 MCQs for paper B. This is how we have designed the blueprinting. So I thought I should discuss the practical aspect of it. And that's about it from my end. Thank you. And I think the house is open for questions. Dr. Chinmay, over to you.
Yes, ma'am. Yes, ma'am. So the one question which is already there in the group, let me throw it. That though it is decided that 80% of practical and 20% of Viva is there, and the 80% is depend on the institute or college. So may I request that what pattern you are planning at your place for a distribution in 80 mark in practical?
Dr. Brunal, will you answer that at your end?
Okay. So ma'am, you have to unmute yourself, Munal ma'am. Yes.
Yeah. Actually, like in our college, we are not following CBME per se, because I belong to AIMS. So we don't have that 80 marks and 20 marks type of thing. But anyway, like we have spotting, then we have got OSCE, then we have got hematology, and we have got some graphical this. Now we have distributed in such a manner that the graphs are given less marks. The spotting has got again say 10 marks of spotting, 20 marks for hematology, and 40 marks are given for the OSCE, and rest of the marks are for this. So that is how we are doing it. Now in CBME, actually they're saying 80 marks in practicals. So if you see the core competencies or skill based core competencies which need to be assessed, they should be given more marks. And the knowledge assessment as per the practicals are concerned, for that we can give some spotting or some graphical, like cal based properties of nerves and muscles. For that we can give 10 marks or less amount of marks. So every institute or every university can design their own distribution of marks, but it is advisable that the core competencies which need to be assessed, or the certifiable skill competencies which need to be learned, which come into the must know domain, they have to be given more weightage. So that if that every university keeps in mind, then the marking system can be varied. I think it is quite different all over India. If you see, some plus minus marks are there for every aspect. So
Yes,
it's
ma'am.
not a uniform pattern everywhere in every university.
Yeah. Thank you, ma'am. Now, can we have some? These are means I'm just trying to collect the different views. So right now, a group of cohort of 150 plus people can know the different views, and then they can suggest at their particular department. Subhuda madam, can you share what is pattern at MUHS?
Hello.
Hello. Yes, ma'am.
Actually, Chinmay, I don't have an exact blueprint in front of my eyes right now. Pandey madam is with
Okay.
me, so if she can recollect that, we can share this thing with you. But definitely, we have a distribution of practicals like hematology, 20 marks. Then we have a question set of short experiments, as we call them, 15 marks. 5 questions, each carrying 3 marks. It is there for 15 marks, and then Viva is there for 20 marks. There, that is so sure. And then human physiology 20. I don't remember the exact heads. Let me find out and I'll share it with you. Okay.
Okay.
And
So,
in the
ma'am,
meantime,
I
if
request you to share in
yeah,
the group.
yeah,
Yeah.
yeah,
So, Richa
just give
madam,
me
one
some
more
time.
question to
Yeah,
you.
yeah. I think
People are
one
asking
thing
for
that
the link. People are
Dr.
asking for the link for game or our app.
I don't know whether my institute will share because they have the copyright of this. So I'll have to talk to my institute if they would like to share this. Yeah, but
So I
it has,
request you that
yeah,
if you get permission, please share in our both the WhatsApp group, so
yeah,
people will get advantage of it. Even if it is
yeah,
free, paid, whatever is there, you just share it with you. And one more question to Mrunal madam, that
Yeah.
query we are getting regarding Atcom. How about the Atcom in practical?
Atcom in practicals, again, it is skill based. It is mostly attitudinal. What we saw in Atcom was mostly attitudinal. So the attitudinal domain can be assessed by how that person is interacting with the subject or the patient who's there, and a clinical examination is being done. Those kind of things need to be assessed. We don't give any marking as such. We are putting the Atcom modules in each of the OSCE or OSPE that is being assessed. So no separate marks are being given to Atcom at present. Though like in theory, we are giving one question of Atcom and we are giving mark to that. In practicals, we don't have something, 5 marks for Atcom, nothing like that. But we are giving, say, in the OSCE or OSPI, which we are preparing, say half mark or 1 mark to the attitude of the person or to how he is respecting the cadaver in anatomy and those things. So those fractionated marks in the OSCE and OSPI are given vis-a-vis the Atcom.
Yes, ma'am. Actually, we are also following the same pattern, that in one of the OSPI, that half mark is regarding the student is greeting or not. Actually,
Yes.
we are using a hybrid model of OSCE and structured Viva, that we have till now we have 8 OSCE and OSPI station, out of which 4 are procedure station and 4 are question station, and simultaneously we will have a 2 structured Viva station. So in that we give 1 mark or 2 mark regarding the
Atcom.
attitude, as you already suggested. Yes, ma'am.
Yes,
So
yes.
Dr. Seetal has shared MEUHS pattern in one of the group, and according to the what is shared in the WhatsApp group, hematology major 20 mark, clinical question 20 mark, OSPI 4 questions 5 marks is equal to 20, hematology minor 10 mark, human experiment 10 mark.
I just wanted to add, I think everybody has a set pattern of taking exams as far as practicals are concerned. But what Dr. Pathak said, that this time we need to restructure that, because we have to keep the Atcom module in mind, and as well as certifiable competencies. And it is really, really important that we keep the certifiable competencies as um, as a part of the assessment method, because otherwise they will lose their relevance.
Okay.
Yes.
So, ma'am, Richa ma'am, as you have taken us to the guideline, the question is, as per the guideline, if we don't think regarding what to do, what not to do, but as per the guideline, do it says that Atcom is must in practical, because in theory it is said that it should be asked in one of the paper, but does it say in practical that you have to ask in one of the question like that?
Not really. I think it has mainly been in, I think, theory, they're asking that you should ask the questions. And I think, as we discussed, that the 3 departments or the 4 departments in first proc need to sit together and decide what part of Atcom the departments will be taking up. And the questions relating to that part of the Atcom has to be in the theory paper of that subject. But I think everything that is theory can be, I think certain part of it can be reproduced in the practical aspect. Nothing that specifically has been mentioned, but like ma'am said, when we are talking to the patient, we are greeting the patient, or if we are, palpating the patient and we are warming the hands and winters, these are the aspects of the Atcom module which we have to take forward. The patient-doctor interaction and so on. So why not include it, a part of it? Why not?
Yes. Okay, Dr. Neeraj is there. Dr. Neeraj, you can unmute yourself and share your views.
Hello,
Dr. Neeraj,
I'm heard.
yeah, please. Yeah.
I'm saying is that if you all have noted, students give more time to anatomy. And for example, once anatomy, say, part ending exam is out, then our teaching, learning, our lectures, our assessment, they all are affected. Have
Yes,
you
sir. Yes,
noticed?
sir.
Have you felt that? Because
Yes, sir.
you
Yes, sir.
see, the PPG examination, in first year examination, weightage is same. But if you ask any student, you will find this. This is the fact. Then how we can go for this ongoing assessment and all that? Have, as physiologists, we have thought of that? This is my question. I mean, we have to put our views. Okay, all 3 subjects are equally important. This is my concern, as it is being said that ongoing should be there or not. So somehow we should react to that. This is my question.
But
Yes,
sir,
he
you
has
also
already given.
Yes.
Yeah.
What we can think of is that actually weightage of the marks in the professional examination is same for all the 3 subjects, that the students are aware. Now the syllabus that is there, or the difficulty level of the syllabus, is perceived differently by different students. There are some students who find physiology very difficult, anatomy very easy. They are few, of course, they are bilkul, you can count them on the fingers, that few. But yes, difficulty level
But
of the
I think madam, they are really very few. What
yeah,
you are
they're
saying
very
is that that percentage is very very less, in my opinion. I may be wrong
yes.
also.
Of course, that is what I'm saying. Like you can count them on the fingers, whereas anatomy is perceived as very difficult and vast portion and huge, those kind of thing. So it is the perception of the student. It is not that the weightage is less. Now, like they require more effort to study anatomy as compared to physiology, and more effort for physiology as compared to biology. So that is what the students perceive.
Yeah, and
So what
Mrunal,
we do,
one more point is far more number of teaching hours are allotted to anatomy.
yes, far more number is
Yeah,
it.
far more number is allotted to. So
So
naturally,
again,
students
it
are
is
scared of
dependent
anatomy.
on
Yeah.
syllabus. No, it is
It,
dependent on the
it affects
syllabus.
for teaching, learning, and especially assessment. And if it is
Yeah.
going to be on ongoing assessment, it is likely to be affected quite significantly.
See,
So this is
ongoing
my
assessments
concern,
in our
like,
institute,
practical
yeah,
concern. We discuss it in the say webinar and all that, but it is actually practically something we should think of.
in our institute, what we do is that we have designated weeks. First week will be anatomy assessment. Second week will be
Hmm.
physiology assessment, like that. So suppose one particular assessment, continuous assessment of one system I have to take, and I have completed hematology, say in the third week. Then my assessment in physiology will be in the second week of the month only, the next ongoing month. So that way, the weightage is given. The students are also aware of this. So they know that first week there will be anatomy assessment. Second week there is going to be a physiology assessment, and third week is biochemistry assessment. So they study that way, and they do not miss classes of other subjects for that particular assessment.
That is the main concern. Yeah.
So that we are able to achieve that with this method.
Yeah. That is true, and you have made it so structured that all the three departments are getting equal time, equal weightage, and students also respect all the three subjects equally because of this.
Yes.
Yeah.
I mean, I wonder if
So
it is happening in majority of the state medical colleges. This
It's
I really wonder.
no, I even I doubt. I doubt.
Hello.
so ma'am,
Hello.
what I request that please share your timetable, whatever structure you have made to both the group, and so we all the resource person as well as all the our cohort will go through it, and we'll try to incorporate in this new year. I think
The
probably we may start
timetable,
after 2
yes.
months.
Yes. I'll share the timetable with you. Like we have got those 3 hours practicals and all, we have made quite, now being an autonomous institute, not under MCI or any this, we have that flexibility and liberty. So every year we keep on changing the timetable. So depending on the feedback and the assessment of the students and how much we are able to put up, and we take the feedback from the students also, how much of assignments they need, what frequency of assignments they need, what is the assignment that they enjoy the most. So we experiment a lot at our institute in all these things. And that's why every
That's
year we have got
wonderful,
different
ma'am.
timetables.
That's wonderful, ma'am. To take students'
One more
feedback
point.
for all these things is really irrelevant. Yes, please. Go ahead.
Dr. Swapnil, you want to share something?
Yes, the attendance is in our within our grasp, so we can mark the students as absent, and some mandatory attendance is required. So not inflating
It's
the attendance at the end.
Yeah.
yeah. So
One biggest problem.
Pandey ma'am is there. Yeah.
Hello.
Yeah, ma'am.
Hello.
Yes, ma'am.
Can you
Yes,
hear
ma'am.
me? In my
Yes.
Yes, ma'am. Yes, ma'am.
huh,
Yes, ma'am.
huh. Regarding the assessment of anatomy and working hours, teaching hours, they give distributed over the three subjects. There is a lot of disparity. Biochemistry, they have got very less teaching hours, but marks of the paper and
Yes.
practical,
Yes.
they are same. And for anatomy also, there are teaching hours, there are too many as compared to say physiology, but marks distribution. So what happens that they keep on giving assessment very frequently because students are with them for more longer time.
Length of
Dissection hours, 2 hours per day, that time is given to them, and therefore students they come in contact with anatomy people more as compared to say physiology and biochemistry. And that's why we can say that they are always say after the subject anatomy, and they neglect physiology and biochemistry. That is what my views are there.
Yes, ma'am. I
So
also in a lighter mode we can say that
no,
physiology people are physiology faculties are physiology miss
yeah,
within physiological limit, and that's why students take us lightly. Okay.
yes,
One more
no.
biggest problem I would like to throw.
So see, at the level of MCI also, at least they should change the distribution, or at least for say biochemistry less hours are there, so they should give only one paper or something. Sort of say distribution should be say variable. I think if the teaching hours they are variable, that is what I feel. Because more time or more junk, if it is given to anatomy, then students they are going to read anatomy more.
Yeah.
and
I
One
mean,
more
I
question.
really think there is a role
Hello.
of physiology and biochemistry teachers as well,
Hmm.
because whenever I talked to anatomy teachers, they are having the, I mean, it may different in different institute, but I am talking about majority of the state medical colleges which are in plenty, वही majority में है. Anatomy
Hmm.
teachers का ये मानना ही है कि first year basically belongs to anatomy. So
Yes.
something must be done. Otherwise, these things will be like every class assessment, all class assessment. These will be more or less theoretical, less practical, or difficult to implement.
Ne- as far as assessment is concerned, no, they keep on giving assessment very frequently, and that's why students they learn, or they give more weightage to anatomy people only, because
Yes, ma'am.
they have dissections, and students they are with them no for more hours. So
Yes,
but
ma'am.
I mean,
can I
my
share?
major concern is
Sir,
that
sir.
have
Uh,
as physiologists we have accepted this. I mean, we should
yes,
do कि
yes.
सबका
sir. Sir, we
importance
understand
बराबर
Hmm,
है,
that
तीनों
hmm,
हमको
बराबर
अपना
हैं,
hmm,
मेन में क्वेश्चन बराबर आते हैं. So
hmm,
I mean, ये मेरा मेन concern है.
hmm, hmm,
yes, sir. Yes, sir.
So,
Definitely. So there
hmm.
are few
I,
questions I would like to throw light on it also. But
in
we
relation
all
to
agree
that,
with
I want to share
all the
with my.
cohort of 150 people are agree with Neeraj sir that we have to raise our voice, and we'll do that in
Chinmay, I want to share my
another.
one, in continuation with this, I want to share my one more observation. As biochemistry classes are less, and
Hmm,
as Pandey Madam has said, ki mark distribution
hmm,
is same, so students
hmm,
have got more chances to score many marks in
But
biochemistry as compared to
right,
anatomy physiology.
yeah,
So their
yeah.
results, number of honors, number of distinctions are far more
Hmm,
as compared to us.
hmm,
Okay, and the
right.
college always compares ki in which subject how many honors the
Hmm,
students have secured.
right.
That is my
Hmm,
observation.
hmm. Portion is
So
very less, no, for the
Portion
syllabus.
is
I have
less.
Huh. So
let me
there
provide
are.
the solution. Let me provide solution for this.
Yeah,
Hmm,
please.
We can, but you all will not agree with my solution. My solution
hmm,
is only become more stricter. Okay, in first internal exam, can you become so strict and you can allow only few students to pass? If it happens to 2 year in any institution, students will start reading physiology, but we will not do that. This is the only
No.
solution. This is
Sir,
the
the
in
only
private
solution,
university,
institutions
and
we
we
cannot.
will not do that.
universities are student friendly. So student friendly they are.
Ah,
So we.
hmm,
Let
ah,
we remain we.
hmm,
One question is that can we have a
Or
OSCE?
else there is another solution. Chinmay, there is another solution.
Yes, ma'am.
Chinmay,
Hmm.
Yes,
another
ma'am.
Yes,
solution
yes.
is that we can make physiology more relevant to the community or patient care. Like, we can, instead of teaching ergography, we can start teaching treadmill and the CPEX. or instead of teaching this routine hematological investigations, we can take CBC and we can show the reports and discuss those reports and have our questions on the reports of the CBCs, rather than only hemoglobin and Ts and DNCs.
Yes,
We
very
can
good
change the
idea, ma'am.
pattern of
Sir, I
teaching
have one
by
point to add.
That is now included in early clinical exposure sort
Early
of thing.
clinical exposure. We are doing
So
that.
now,
Yeah.
Chinmay
so
sir, I
now,
have one
we are
point
still
to add.
holding
Can
on
you
to
just
that.
add?
yes,
Matangi,
Matanga, ma'am. Yeah,
yeah.
please.
This was one of my experience during the orientation program. What we did was we made the third year, final year, and the intern students address them and tell them how important are these first year subjects to them when they go till the internship. And you'll be surprised, all these three batches of students said how much of physiology they are using it.
Exactly.
That impressed a lot of the first years. They just said, ma'am, will they ask questions on this in the final year? Will it be useful for us in the patient care? And with the CBME coming up, it actually imprints on them how much of physiology they cannot forget after writing the examination. I think that in itself is a win-win for a physiology. That's what I just feel
Yeah.
like. And when
That
it
is a
comes
good
to
idea.
their own seniors, it really makes an impact on them.
I think as far as CBME is concerned, it has given us more, I think, a platform. We need to be more creative as
Well,
far as physiology is concerned.
in my
More
opinion,
seminars, more simulations.
everything should be tried. What Dr.
Yes.
Chinmay said that also to an extent should be tried,
Yes.
because many students, they worry immediate examination rather than what they would be doing 5 or 6 years down the line. And along with whatever other has suggested, that more and more we should teach relevant things. So everything should be tried. This is my opinion.
Yes. So
True.
now the role of all the group participant is, when you are
Yes.
presenting your group presentation, take all this discussion of last 15 minutes into consideration and put your point, put your voice in that presentation too, that how you can make it more relevant, more contextual, more community oriented or clinical oriented, and how can we improve our own presence in students mind, or we can say in students heart. Then and then physiology will go ahead with the competency based education. So I think we have no more questions, or questions are there, discussion is going on in group also. So now let me come to this, uh, let me ask all the three experts that if they have to say something, let first finish that, and then I will go to the schedule of the group presentation. Dr. Swapnil, Dr. Richa, and Dr. Munal, you want to say any final words?
No, I believe you can
No,
continue,
sir.
Chitra. You can continue.
Okay, thank you, thank you.
I just
So
want to add one thing, that I
yes
just
ma'am,
want to
yes
add
ma'am.
one thing, that perfect assessment is an illusion. So we can try different modules, different ways to make it as perfect as possible. That's it.
Yeah. So, dear all friends, teachers, seniors, colleagues. So we have continuously gone through, starting from our what CBME, and today we have come to an assessment. We have taken ECE and all the SLO, different things. So all the aspects of CBME has been covered in detail by the different faculties uh, in regards to physiology basically. So now it's your turn to speak up. Now it's your turn to say your view, your concern, and as we have decided in the beginning of the course, that at the end of this course we should come up with the material which is useful to India as a whole. And I am very happy to see that our CBME Physiology Group 1 and Group 2, all the people have started working in spite of COVID duty, in spite of their family reasons. All have worked very hard. And so I think there should be a virtual clap for all the groups and all the
Yes.
participants. So we can clap for them. And so they have already started putting their presentation in the group. Now, what we are going to do next? Let me bring the schedule. So I am just putting up the schedule here. Now, can you see this? Let me enlarge it so everybody can see. So we have a total 11 heading under which MCI has described the competencies. Okay. So starting from reproductive, date and time has been mentioned. Time will be 8 o'clock, and the dates are again the same, Wednesday 8 o'clock. So now what we are going to do? For example, for reproductive physiology, we have a two group number 18 and 19. So what they will do now? So all group, the group will share, or as a coordinator, I will share a link of both the group to each other, and so now they can personally. Right now we have all the presentation in large group of CBME Physiology and CBME Physiology 2. But now, along with the assessment, along with the ECE, along with the SDL and SGD, now group 18 will look into the presentation of group 19 and comment, and same way other group will look into the presentation of another. And we will now have a mixed presentation of combine both group of reproductive system. In that also, as I am dealing right now with the reproductive system, I know that we have divided them into first half and second half. So first 20 minutes will be given to a first group, for example 9.1 to 9.6, and second 20 minutes will be given to group 2 in the reproductive physiology, and last 20 minutes we will discuss is there any change or any modification is required. So we are starting with the 14, and first is the reproductive physiology. uh, so after presentation, again I am repeating, first is today only I will give link of each group to each other, so they all can join in both the group and can comment, discuss, modify the presentation. Then they will do a PPT presentation on 14th, and we will have a large group comments, and by 15th or 16th all comment will be taken care of and will be shared in the Excel sheet and will be uploaded into Google Classroom. Okay, so any question regarding this? Any questions regarding this? So we have a two hand raise. I am just unmuting Dr. Anupriya and Dr. Minu. You both are self muted. You can unmute yourself. Okay. So one comment is, can you just repeat? Yes, ma'am. I am just repeating. So this is the timetable. Okay. So I am just putting the timetable in group also, along with our discussion is going on. Last slide. So what will happen that, for example, in reproductive physiology, there are two groups who have a competency of reproductive physiology. So they will look into the presentation and competency and SLO of each other competency, and by 14th both the group will present here in reproductive physiology. So first group will present in first 20 minutes, second group will present in second 20 minutes, and next 20 minutes we will use for the discussion. Once we get comment from the large group, it will be incorporated and then it will be ultimately transferred into the Excel sheet and it will be uploaded into Google Class. Okay.
Hello.
So this is the way we have to present. Yes.
Hello. Chinmay. Hello.
Yes, ma'am. Yeah.
Dr. Pandey here. For
Yes.
neurophysiology, in total, how many groups are there? I find that there are more than 5 or 6 groups for
Okay. If require,
neurophysiology.
okay, ma'am. So let me know. So we can schedule it from. We will also give one more day, so that presentation can be justified. If require, please let me know.
Yeah.
So we can just figure it out. Okay.
Okay.
Okay. Any other questions? So if there are no more questions, we can call for the day. Assignment has been already there in the Google Classroom, and we will share the recording by tomorrow or day after tomorrow, as and when we get from the platform of GoToWebinar. And this I have already shared in one group, and will share in another group also, so that we can start preparing. Okay, and I think the last is by Dr. Neeraj, so we will have a fabulous what we can say musical end of this program by Dr. Neeraj.
Oh.
Okay, and that's why I have purposefully kept him at last. So we will have one song, or just like a valedictory function we will have. Okay. So thank you all.
I just want
Good
to
night for
add,
today.
Dr.
Yes,
Chandra,
yes,
just
yes.
I just want to add one point. I think there are a lot of verbs which are there. So more number of verbs, different types of verbs should be used as far as the objectives are concerned, because I have seen a few of the slides and similar explain, discuss, and similar are being used. So I think the teams can use more verbs. And number two, there shouldn't be so many objectives that they lose their relevance in a competency. So sometimes there are very, very small objectives. That is my viewpoint for the group.
So ending the session now, and we will keep discussing in the group also, and we will share the recording as and when it's make available. Thank you all. Thank you all the three presenter.
Thank you so much.
Bye.
Have a good night.
Bye. Thank